Hello, everyone. My name is Nicolette Diaz, and thank you for joining me today as I discuss our latest initiative in supporting mental health and well-being. Here at CN Oncology, we are all in this together. With as much effort we put forth physically and mentally, it can all become quite overwhelming if not properly managed. The pandemic especially has shown us how important flexibility and its related benefits are during challenging times. After gathering feedback and conducting research, we've recognized that while working in oncology can be fulfilling, it can also be mentally demanding. Based on a survey of healthcare workers in more than 100 client organizations, 63% screened positive for depression and/or anxiety. 16% of participants screened positive for PTSD, and 77 said their own adverse mental health interfered with their work, social, or personal lives. In addition, these workers, on average, reported 2.4 days of disrupted productivity every week. As a result, we understand how critical it is moving forward that we provide mental health benefits for all employees here at CN Oncology. We are proposing to provide these mental health benefits to aid in managing burnout, depression, anger, and feelings of helplessness. The mental health benefit would include EAP services, up to 6 free sessions of therapy, referrals to therapists or psychiatrists, support for spouses or domestic partners or dependents, a 24/7 crisis line, paid time off for mental days up to 2 designated days, manager and supervisor training that teaches how to spot burnout, wellness and resilience resources like ongoing workshops, access to wellness apps, support groups, and stress strategies. Routine workforce feedback and mental health evaluations are paramount as well. This would be confidential screenings for depression and more. Pulse surveys will be implemented, as well as ongoing feedback mechanisms. CN Oncology can cultivate a stronger workplace culture by making mental health discussions commonplace, integrating support resources into everyday routines, and guaranteeing that access is easy, confidential, and free of stigma. Based on the effective approaches used by other organizations listed here, these methods may help lower burnout and turnover while also improving employee well-being and patient satisfaction. Incorporating mental health benefits into CN Oncology's total reward system can assist the organization reach its goals by improving recruitment, retention, internal alignment, and external competitiveness. By delivering options that mitigate the challenges associated with specific roles, we strengthen our position in a competitive job market. As benefits constitute a significant component of total compensation, the strategic provision offers a distinct advantage. This can attract candidates seeking a supportive workplace culture, employers who value mental well-being, as well as alternative benefits packages. At the same time, ensuring that these benefits are equitably structured and clearly communicated promotes internal alignment. This benefit will also aid in retaining current top talent by lowering burnout, voluntary turnover, and especially in this high stress environment. Internal alignment ensures pay and benefits reflect job value and business strategy. For mental health benefits, this means providing equitable, consistent, and transparent programs like EAPs, therapy, and wellness apps across all roles and locations. Inconsistencies can lead to perceived unfairness and reduced morale. At CN Oncology, we should standardize eligibility, clarify benefit purposes, and maintain equal access and communication to reinforce organizational fairness. Offering market competitive mental health benefits helps CN Oncology attract and retain talent as well by strengthening its employee value proposition. Comprehensive, inclusive programs differentiate the organization and show commitment to well-being, while falling behind competitors can harm recruitment and retention. Regular benchmarking keeps offerings competitive and supports workplace stability. Evaluating mental health benefits requires tracking metrics such as EAP utilization, absenteeism, turnover, engagement scores, and healthcare costs linked to stress or mental illness. Benchmarking with external data guides strategy and transparent reporting to leaders demonstrates program value, and supports evidence-based decisions for aligning total rewards with organizational goals. Expanding mental health benefits demands robust coordination and change management. Organizations must select vendors for EAPs or therapy apps, undergo legal and procurement processes, and align these with existing insurance. Staff training is essential for HR and managers to understand and communicate offerings. Technology systems require updates for secure and easy access. Internal communication campaigns help raise awareness and add to HR's workload. Employee use of mental health benefits often remains low due to stigma and privacy concerns. Fear of judgment or reputational harm can discourage participation, limiting program impact. Reducing stigma requires ongoing cultural change through leadership, peer examples, and thoughtful messaging. Ensuring equal access across roles, shifts, and locations is challenging. Night shift and remote workers may have fewer opportunities, leading to perceived inequity. Organizations should offer flexible options and inclusive scheduling to maintain fairness and trust. Mental health benefits are regulated by laws such as ADA, HIPAA, and MHPAEA. Employers must ensure parity with physical health, protect employee privacy, and avoid discrimination. Mishandling information can result in legal issues, fees, and reputational harm. Ongoing funding and strategic alignment are needed for sustained access. Organizations must monitor usage, engagement, absenteeism, and ROI, using anonymous data and regular reporting to adapt programs over time. To ensure the successful introduction of new mental health benefits, the company will implement a comprehensive multi-channel communication initiative prioritizing clarity, transparency, and sustained engagement. An introductory video from senior leadership will explain the organization's commitment to employee well-being and provide an overview of the available benefits. Employees and wellness ambassadors will present authentic accounts to promote help-seeking behaviors and mitigate stigma associated with mental health. Strategically placed posters in high-traffic locations will enable immediate access to EAP services, crisis hotlines, and wellness resources via scannable QR code. Well-designed emails and a centralized intranet portal will deliver detailed information about benefits, confidentiality protocols, and instructions for utilization. To enhance engagement and retention, the campaign will incorporate interactive and wellness-promoting elements. A gratitude wall, a physical or virtual platform, will allow employees to share positive messages, thereby building a sense of community and encouragement. Mobile reminders, a supportive prompt such as take your 2-minute pause, will be disseminated through internal applications to encourage participation in mindfulness activities and mental health breaks. The campaign is aligned with established best practices to maximize trust and adoption. Senior leaders and ambassadors will engage in open discussions about mental health, demonstrating acceptance and support. All communications will highlight stringent privacy standards and compliance with HIPAA and EAP guidelines. Staff will be incentivized to explore available resources through a wellness passport or points-based system, offering rewards for active involvement. Supervisors will be equipped with referral materials, discussion guides, and training content to assist their teams effectively. Regular pulse surveys and suggestion platforms will solicit employee feedback, allowing for ongoing refinement of communication approaches and benefit delivery. I hope you enjoyed our presentation today.